Episodes of major depression, when they present in the context of bipolar disorder, are particularly difficult to treat. As a field, we're often looking for new treatments that can both treat these symptoms of depression, but not exacerbating the underlying risk for mania. Cariprazine is a new antipsychotic medication which has recently been shown to be effective in the treatment of schizophrenia. Early and colleagues report results from a new important phase 3 trial in the use of this medication for the treatment of major depressive episodes in the context of bipolar disorder. Important new data come from this study. In particular, the data suggest that cariprazine may in fact be quite helpful for the symptoms of major depressive disorder in patients with bipolar disorder. And this should increase clinicians' awareness about a potential new tool to add to their armament when trying to treat this difficult clinical problem. Anorexia nervosa remains one of the most difficult conditions to treat. There is a major need both for new psychotherapies and for new medications. Attia and colleagues report new data from a randomized controlled trial in a sample of patients with anorexia nervosa. The data from this trial suggests that this medication may in fact be quite helpful for these patients. Given the difficulty of improving symptoms in such patients, this should increase clinicians' attention to a new use for a medication that has been around for a few years now. Clinicians are encouraged to review the data both so they can understand how this medication is used for this condition that is not typically associated with psychosis, but also so that they can anticipate the magnitude of clinical response that they might expect.